Good afternoon, everybody, and thank you for your patience. I'm excited to be here with you today, and I want to thank Tracy Gates for this idea of trying to reach out to you and to offer you an opportunity to answer questions or ask questions that I could answer with you. And we will see how today goes and then determine if we want to do additional Q&As in the future. So again, thanks, Tracy, for a great suggestion. I'm going to begin today with a short video clip from Dr. Robert Renfield, who is the director of the CDC. And yesterday there was an update from the COVID task force, and he spoke about schools for a couple minutes, and I'm going to begin the presentation with that. And then immediately following, we will talk through the top 25 questions we received. We had 340 questions submitted. We try to look for the most frequently asked so I can talk through them today with you. So indulge me and we'll watch just a few minutes of those and I'll go right into your questions afterwards.
We should be making data-driven decisions when we talk about what we're doing for institutions or what we're doing for commercial closures. For example, as was mentioned, last spring, CDC did not recommend school closures, nor did we recommend their closures today. I will say back in the spring, there was limited data. Today, there's extensive data that we've gathered over the last 2 to 3 months to confirm that K through 12 schools can operate with face-to-face learning, and they can do it safely, and they can do it responsibly. The infections that we've identified in schools, when they've been evaluated, were not acquired in schools. They were actually acquired in the community and in the household. Today, as Dr. Burke said, our big threat for transmission is not the public square. It's small family gatherings where people become more comfortable. They remove their face mask and they get together, and it's this silent epidemic that begins to transmit. But it's not inter-school transmission. The truth is, for kids K through 12, one of the safest places they can be, from our perspective, is to remain in school. And it's really important that following the data, making sure we don't make emotional decisions about what to close and what not to close. And I'm here to say clearly the data strongly supports that K through 12 schools, as well as institutes of higher learning, really are not where we're having our challenges. And it would be counterproductive from my point of view, from a public health point of view, just in containing the epidemic, if there was an emotional response to say, let's close the schools.
What Dr. Renfield is saying is that his recommendation from the CDC from March has been to keep schools open. And his position has not changed. In fact, it has become more solidified in that now there is more data that supports that not only should schools remain open, but there is no evidence that is suggesting that schools are contributing to the spread of what's happening in terms of the virus and the outbreaks that we're seeing across the country. So I wanted to share that with you. After he spoke, which will upload the video again, as I said previously, a psychologist also spoke about the social and emotional well-being of students and the power that comes with keeping schools open. And I think that those few minutes are well worth a watch if you have the available time. One of the biggest things that we have been focusing on is a decision-making matrix to try to guide our decision-making process on whether or not we move from tier 1 or tier 2 or ultimately tier 3. And you can see the items that are listed on that. That has not changed. Many of you asked for more specifics. I can talk through those questions for you, but it really is a combination of variables to come together to make a decision. One of those is state and federal guidelines issued as needed. And that's why I thought that Dr. Renfield's comments from CDC yesterday were so powerful in the campaign to try to remain in tier 1 for as long as possible. I'm going to show you the COVID dashboard at this point just to see where we are. Right now, we have 24 active cases. It's the most cases we've ever had. We were extremely fortunate for the first portion of the school year, and the last 14 days we have seen an uptick. As you can see, we have 24 active cases, but only 30 total cumulative. So you can you will notice that there has been more cases in the last 14 days than we have seen for the whole school year. At this time, I'm going to move into questions that you have submitted. I'm going to try to get through 25 today. They're on the screen. I will read them and then talk through them, and I will try to be succinct and to the point and yet comprehensive in how I'm answering them to the best of my ability. So given many people are ignoring the warnings about gatherings for Thanksgiving, what do we think about going remote until winter break or till after winter break? I'm just concerned that it's going to be worse after Thanksgiving. Most colleges are doing this and are remote for December. Uh, we as a district gave this a lot of thought in terms of, do we extend the days after Thanksgiving break to go remote or hybrid? Do we extend after winter break to do the same? And where we are right now is that we are not planning on closing between Thanksgiving and winter break. However, we are going to be monitoring the cases that are present, particularly after the Thanksgiving holiday, to determine if we need to make a change after winter break. Or moreover, if the cases become too extreme in any of the buildings, we could pivot from one tier to the next sooner than winter break if the data supports that that is a level that needs to happen. So it's very difficult to make decisions without data at hand, and we are closely monitoring what happens, and we will be paying particular attention to days 8 through 12 after the Thanksgiving holiday to see what's happening with the trends. Are we staying at a constant rate of positives? Are we decreasing or are we increasing? And then make the appropriate decision possible. It is possible that we could go from a different tier in a different building. For example, we could move from the high school tier 1 to the high school tier 2, and it can be in a 1-week stint, a 2-week stint, or longer. That's different from when I spoke to you in August because we have different data. Right now, we're seeing very different numbers in the high school setting than that of K-8. So we are weighing that out. And additionally, due to staffing limitations and other variables, we may need to make an acute change rather than more of a elongated time where we would move from one tier to the next. I am trying to follow what CDC says to keep those schools open, so I'll be extremely cautious about limiting access for our students to the school environment. Second question is, what changes will be made for schools based on recent Summit County stay-at-home order or advisory? And I would tell you that the changes that will be made are the changes that you decide to make at home as a family. So the stay-at-home advisory is really based on what you do over the Thanksgiving holiday and the upcoming holidays, what choices you're making about parties and get-togethers, and they're difficult choices as families, but schools are going to reap the benefits, hopefully the benefits of smart decisions that our families are making during their times outside of school. And that was further illustrated that we are not seeing school spread. We are seeing community spread coming into the schools from those people that are infected. So the changes that will be made will really rely on what everybody is doing as a collective community when they're outside of the school setting. Dr. Renfield also spoke to that the safest place for our students are in school, and some of the reasons are that they're unmasked, they're in masks while they're here, they are maintaining social distancing, that we are cleaning regularly, we are ensuring that we are following the protocols around safety and advisories to the best of our ability. And that's one of the reasons why, from my vantage point, the numbers have been relatively low in comparison to other areas in the county and in the state, in the country for that matter. But we must remain vigilant, and it's of particular importance in the coming weeks as we go through these upcoming holiday seasons. Next question, if COVID cases at any one building continue to rise, would you consider remote learning with just that building versus switching the entire district? I answered that a little bit previously in the previous question, but just to reaffirm, absolutely. One building can be in a different tier at this point based on how the data is coming in. For those of us in option 2 that want to move to option 1 for the second semester, how do we go about doing that? There has been changes from option 1 to option 2 and vice versa throughout this first semester. We will be releasing plans for how to make those changes for the second semester the week of December 7th in an effort to give parents enough time to make the decision prior to that second semester. So we are in the process of finalizing what that looks like, and we please expect some communication the week of December 7th. It could be anywhere the December 7th through December 11th. Is the district, along those same lines, is the district planning to continue using Jefferson ESC or VLA program for the second semester? Again, we are still working on finalizing what we are going to do second semester in terms of option 2 or the remote learning. Those details will be released on December 7th. We are working with administration and teacher leaders to see what is our capacity and what have we learned from the fall, and do we need to make any changes in the spring semester. Next question was, how do we determine who is quarantined from an exposure? Is it the entire class or proximity of seat location to the positive student? According to the county guidelines, it's any student who is within 6 feet for a cumulative of 15 minutes or more would be quarantined. So any student or staff member who has been in contact with a positive case in under 6 feet for 15 minutes cumulative or more. And we are measuring spaces every time, or most times when we're doing this. If we're unsure, we're going to classrooms, looking at seating charts, trying to increase the accuracy of that. We go for contact tracing 48 hours prior to a person becoming symptomatic to do contact tracing, or if they're asymptomatic, 48 hours prior to receiving the positive test. Next question, can you be more transparent and tell us what percentage of people want to be online and what percentage of people prefer to be in school with the most recent information? I can't tell you at this point what they want. I can tell you what they're choosing, and that is that we're still hovering at 85% of in school and 15% remote. I can give you more information after we release the information about second semester to see if there's any fluctuation one way or the other. But right now, the data, as opposed to what they want versus what they're choosing 85% in person right now. I do acknowledge that circumstances are changing and those numbers may fluctuate, but that is the most accurate data I have at this point. Next question, I can stay at home with my child with rising cases in the district and the public health stay-at-home order. Why not permit parents who choose and can to remote via Zoom with teachers who are now our children, community, and our district? So in an effort to answer this one, students K-5 in option 2 are able to Zoom in with our teachers. In grades 6 through 12, they are able to Zoom in if they are a quarantined student in an effort to try to support those students who are quarantined at this time. So those are the two ways to Zoom in and get Revere teachers in this junction in time. Again, we are exploring options for the second semester. More details will come out December 7th. Is there any evidence showing if or if not any of those cases have been transmitted through school and classroom? The answer is no. For the evidence we have here, and we have quarantined hundreds of students at this point. Moreover, when we upload the Dr. Robert Remfield information, he will say that the CDC confirms the same information, that there is little to no evidence showing that there's any transmission from school spread. And that's why CDC is recommending that schools stay open. staying, you don't have to switch the slide back, but staying on the previous question, I guess we're switching back anyway, sorry. That's also in line with what Summit County is saying, the Ohio Department of Health, as well as the governor's office. So the governor's office, CDC, ODH, our local health department, and the data we're seeing at school is supporting that there is no school spread at this time. Next question, what is the reasoning behind canceling calamity days? The reason is really to offer a continuation of instruction regardless of inclement level or inclement weather due to technological advances and access to technology that previously were not available that are now available as a byproduct of the pandemic. I will tell you there have been multiple conversations about this decision, and there are more conversations that are still looming. So please stay tuned. I will make sure that I update you if any changes come regarding that decision. Next question. Someone needs to explain to parents that quarantine does not mean that the student is positive with COVID. What percentages of quarantine students converted to a positive test? So the percentage of quarantine students converted to a positive test are 0. And quarantine does not mean that the student is positive with COVID. We have been trying to educate, but we will take that question to heart and try to put out more public service announcements that say quarantine is just quarantining and it has no relation to a student who is positive. I have heard of parents and students becoming upset or frustrated with students who are positive, or staff members are positive, or students that are quarantined, or teachers that are quarantined. And I would just ask you to be mindful of how you would want to be treated if you or your child was in one of those situations. Everyone is under a tremendous amount of stress during this time, and every little bit of positivity really helps. Next question is, what numbers on your matrix would determine hybrid or remote learning, and where do the numbers have to be to make that decision? Right now, in support of or in support with CDC of trying to keep schools open, I don't have that answer to you. I can tell you that right now we're hovering at 25% of the high school is quarantined. In other school districts that have remained open, that have been open longer than us, the high school quarantine number is averaging around 30%. So we are watching carefully of how many students are quarantined to try to see if it is getting closer and closer to 50%. We're almost in hybrid at that point anyway, so it seems logical to move to hybrid if we are getting closer to 50. But I will tell you that in other districts that are full in, that have been open longer than us, the average that they're seeing is 30% hybrid. If I make a decision to go to hybrid, I am committing that 50% of the population is going remote at that point every day. So I'm trying to figure out what is the best. In my opinion, right now with 25% in quarantine, we're beta testing the hybrid model to some extent, albeit not perfect, but we are kind of getting the feel of what it would be and what works and what doesn't work should we make a full-scale switch for the high school to hybrid. Can you explain the subbing or staffing situations at the middle school and where things stand? Is there a shortage of subs combined with the high number of absences that require teachers, principals, counselors to cover the cases? The answer is an absolute yes. We have been hovering around 61% fill rate for substitutes. That's an average of this week. So we have had teachers cover, principals cover, counselors cover, aides cover. It's all hands on deck. And this is a major concern of mine. And it's certainly taxing the teachers in ways that they haven't been before. And I want to thank them for coming together. But it is most difficult and challenging for them because they are losing their planning time, and it's not giving them any time to wrap their head around what they need to do to prepare students for that day or the next day or the following. So if anyone in the area is capable and willing of subbing, we are in desperate need of subbing. This is not a situation unique to Revere. In fact, every district that I've talked to in the immediate area is struggling with maintaining subs to fulfill the absences that they are experiencing. Next question, you talk about the student's social emotional well-being as one of the top factors in your decision about what tier we're going in. How are you measuring their well-being and what data are you using? If you listen to the COVID task force update after Dr. Renfield, the clinical psychologist, talks about the social emotional well-being and how important it is for students to be in school, we are providing as much support as we can for students, acknowledging that they are struggling right now with social emotional well-being with the stress and anxiety of being in school. I will tell you that this is one of those lesser of the evils. How much am I going to this is the question I'm asking myself, how much are we going to impact the social well-being of students if we were to go hybrid or remote? Because what I saw in the spring semester, when we were remote March, April, May, there was a great toll on the students' social emotional well-being. I would argue there were more students impacted negatively by being remote than what I'm seeing right now in brick and mortar. Some numbers though, we have the counseling department has, in both the middle school and the high school, have run a total of 10 suicide protocols since September 8th. We have also referred over 60 students or families to community counseling or community supports. And I truly believe, and the CDC is supporting this as well as the WHO and the ODH, that the ability to provide the social emotional support is far more comprehensive if we are providing it while the students are here with us in brick and mortar instead of supporting the students through SEL or social emotional learning from a remote setting. Currently, we have 24 cases in the district. Based on a quick review of other school districts, 24 seems high. What is the threshold of active cases that you previously set that will determine whether or not the district moves to a different tier? Again, 24 is high. It's certainly the highest we've ever seen. I'm looking at total case numbers, and our total case numbers are still less than Aurora, Brecksville, Copley, Greene, Manchester, Streetsboro, Wadsworth. So while it seems high now, we are lower than all the districts I just confirmed. We've been extremely fortunate in that area. And as I said, I'm looking at the quarantine percentages. I'm looking at absentee rate. I can't give you a number, but I'm watching it closely to see, is it going to continue to increase? Is it going to stable off, or is it going to decrease now that we have students that are falling off because we're beyond that first 14-day cycle, and we have new ones adding. And I'm sure every day you're seeing emails of new cases. Thankfully, right now, we're also seeing as new cases are coming on the dashboard, cases are also falling off. So we're watching that carefully. But again, the one building that I am looking at making a change in the immediate future would be the high school. Outside of that, K through 8, I am looking at no changes unless things go horribly awry in terms of the bottom falling out in those buildings. A special education question. If the tier levels change, will the students with IEPs still go every day? We are working through the special education department and the intervention specialists to try to answer that question. We will base the IEP students or the students with IEPs needs from greatest to least, and we will support them to the best of our ability. There will be students that receive services throughout the week. I can't commit because the individual education plan is just that individual. So we will be working with administration, special education teachers, as well as families to see what is the best fit for students. But I am planning on offering more face-to-face services if the tier advances for our students of greatest need, if that tier changes. Parents are only encouraged to report if their children have COVID to the school, but not required. How much do you think the number of cases is being underestimated by? The only answer I have to that is if a student is tested and obtains a positive test, the Summit County Health Department reaches out to us. So we know if they get tested, whether they call and tell us or they don't. The unknown is if the family decides not to test the student. And I don't have any idea of knowing what that possible amount is, if any. Mental health has always been a concern, and that is why we're here 5 days. What about mental health of the kids still going or in quarantine? What are we doing about the tolls taken on them still being open? So the biggest thing we're doing right now is we're trying to Zoom classes. So we want them to still have interactions with their teachers and with their students and still have access to the curriculum to try to alleviate that stress. Although I think that this is causing a great deal of stress for the individuals, at least 25% of them at any given time. The other thing that I would urge families to do is that if you feel as if your student is in an area of stress that you are worried, please reach out to any of our school counselors, K-12, or Mrs. Bonnie Simonelli, or an administrator or a teacher where that the students have. We will backfill support to try to help you. Our counselors are an amazing group of individuals who will move mountains to help our students if they show the need for support. If we go remote, does that still mean sports or extracurriculars are canceled, or has this been changed to reflect the other remote schools? At this point, if we go remote, which is tier 3, we are still going to cancel sports and extracurriculars. However, that decision is subject to change. So that's what I said in August. I stand by that, but we're monitoring it closely. We're particularly looking at other schools that are going remote that are still operating extracurriculars and what their cases are seeing. Are they still seeing high numbers? Are they not seeing numbers? Are they seeing numbers trail off because they're in remote? If you look at a snapshot right now, the districts that are remote have higher numbers of positive cases than we do. And they also have higher numbers than the districts that are in hybrid right now. So it further supports the idea that there is not a tie to school spread, which is in line of what we've been talking about today. What is the percentage of students or staff that have to be in quarantine or have to go or have COVID to go hybrid? I've been looking at 25% for quarantining. I told you the average in high schools that I'm finding is 30%. The closer we get to 30% quarantine, or the closer we get to 50% quarantine, the more likely we'll be moving into hybrid in one of those buildings. The percentage of COVID, I don't really have a number right now where that's concerned. Why has the quarantine numbers not been reported? And how can the district monitor exposure between classes and lunch? We've been asking this or answering this question frequently. The quarantine numbers, when we were looking at several of the dashboards in the area, they were not reporting quarantines. When we're looking at the state data, they're not reporting quarantining. And we were having a hard time getting an accurate number on the quarantines because of families that are self-quarantining, other students that are quarantined for outside reasons. It wasn't an accurate picture of what was happening in the district. Moreover, what we're seeing with the lack of school spread because of quarantining, it is not providing a landscape of what's happening in the district. What's happening in the district is really seen by the positive numbers or the positive cases that have been confirmed. How can the district monitor exposure between classes and lunch? The hallway exchanges are not a major concern with the students being masks and with the fact that they are not together during that time for 15 minutes or more when they're exchanging classes. We are encouraging hallway traffic, which we've been doing all year to try to make sure there's one-way hallways and trying to be mindful of the exchanges, but is not high on our list of things to be concerned about because of the short time that the students are exposed to each other as they're passing or as they're walking with each other. Lunch, same thing. If they're 6 feet apart, which is what we are striving for lunch, 6 feet or more without masks, then they do not fall within the contact tracing or the risk as defined by both the county and state guidelines. Why are students in quarantine counted absent when they are participating remotely? I just had a conversation this morning with Mr. King about that. They are working in the high school to try to figure out a way to better report that. If they are in quarantine, they're not getting reported to state, but it's still showing up on the transcript. So we are looking at different ways to modify our system so it doesn't look as if they are absent when they're still participating remotely. We will have to work on better measurements if we make that change of how students are being counted for attendance when they're participating in a quarantining environment. But we acknowledge that's a concern of many of you, and we are also working to make that better. Does the Board of Health contact families in quarantine? The answer is yes, or at least that's the experience that we've had. And why is an indoor band concert scheduled for December when the governor and the CDC are recommending no large gatherings? Why can't the concert be streamed rather than having spectators? I think it is being streamed, but we are looking at those. Right now, the reason they're still scheduled is because the state is, just like with sports, the state is allowing for musical events to occur at schools at 15% capacity of the audience. That being said, we're still considering making changes in December. We're going to look at what the numbers look like in December and then make a decision based on the most current data. So I would put an asterisk there that it very well could be no spectators. I'm just not ready to make that decision yet, but we are watching it. And again, the state is still allowing those types of gatherings to happen. The school setting rules are different, just like the OHSSA is saying winter sports and all sports, including wrestling, are full steam ahead at this time. So right now, that is the end of the first 25 questions for the Q&A. I was trying to be as succinct as possible and go over them to the best of my ability. I will monitor the feedback based on, is this something that the constituents thought was helpful or not, and then based off of that feedback, then we'll decide if we're going to do more of these in the future. If you want to reach out to myself individually or Mrs. Jennifer Reese as the communication specialist, we certainly would welcome that. We are working in tandem, trying to respond to the questions as quickly as possible. But I appreciate your grace as we try to manage all of the different questions that are coming with us. And I'm hoping that this was helpful for you. If I don't talk to you again prior to Thanksgiving, I want to wish you all a very safe and happy holiday with your families. I hope you use this time to rest and recharge. Our teachers are certainly in need of time to recharge with their families. And before I sign off, just want to take a moment for the teachers and the staff and the administrators who have been working tirelessly to try to maintain some sense of normalcy for our students during this crazy world we all live in. And in spite of all the craziness, I remain extremely grateful and blessed to be a part of this district. And I thank you for your support, and we will get through this together. Happy Thanksgiving.